Ask Dr. Long, if he would, to lead our pledge. Dr. Long.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, first item is to recognize Joey Eisenhower.
Oh, really? Then Dale. Sorry.
Okay.
Sorry.
Joey is one of our honor roll students at Rome Creek, and he wanted to come and give Dr. Simcox her appreciation gift from Rome Creek Elementary.
Can I wear it?
Thank you. I'm not supposed to be hugging you, but thank you. Oh, that is so sweet.
Thank you, Joey.
Thank you. You can put that right there. That is so sweet.
And this is Superintendent's Month for the U Trust Board.
It is.
And I'd like to say we appreciate everything you do, especially it's been hard during all the COVID business, and we do appreciate you, and it's well deserved. So
Thank you very much.
thank you, Joey.
Yes. Thank
Thanks,
you.
Mom and Dad, for
Made my
bringing
day. Thank you. Oh.
Okay, we'll move on. We're waiting for Dr. Kirksey, who is the director at the Regional Health Department, to call in, and he was going to explain some of our quarantine data. We'll give him a few more minutes, and if he doesn't show up, then we'll ask Wendy if she would to explain that. There are new quarantine rules that we're having to go through that parents and staff need to be aware of, so she'll explain that if he doesn't call in. But let's move on to the consent agenda. If you would, review the consent agenda and any questions, anything you want pulled off, or we'll entertain a motion.
Move to approve the consent agenda.
Okay, Mr. Long has made a motion.
I'll second.
All right, Mr. Payne has seconded that. Is there any discussion? All right, if you would, call the roll, please.
Mr. Long?
Yes.
Mr. Matheson?
Yes.
Mr. Payne?
Yes.
Ms. Reese?
Yes.
Mr. Carlton?
Yes. Next item is our board member, Lauren Patterson, and she's sitting down at the table here. We've tried to socially distance a little bit more, but Lauren, go ahead.
Hello students, and happy November. We are officially over halfway through the semester, and we are glad to see all of your smiling but masked faces. I would like to begin by stating the student board would like to offer our condolences for the family of Miss Martine Hope for her passing. She's been a great member of the JCHS family for years and will be missed. Today we held the senior group picture and individual club pictures. Senior quotes were due October 30th, but if a senior has not yet submitted one, please contact a yearbook staff member or email yearbook@jocoed.net to submit one. Furthermore, senior ad payments are due on November 30th, so if you want to honor your senior, please contact the previously listed sources. Also, our It's a Wonderful Life voice recording by our drama department will be airing December 4th through WMCT. If you are interested, please contact any officer of the Thespian Troop or Mr. Eggers. Also, if any student is interested in purchasing a Thespian sweater for this year, even if they're not yet inducted, payment is due next Friday. There is a blood drive hosted by HOSA and NHS on November 25th from 10 a.m. to 5 p.m. at the Johnson County Community Hospital. Come out and support our students by saving lives. Seniors, if you are interested in attending a virtual meeting with select college representatives when they are available, let Ms. Davis or Ms. Evans know so they can get in touch with you when the opportunities are available. Also, don't forget to fill out your FAFSA and that college applications are now open. Also, tomorrow night, come out and support our football team. As we near into the winter months, be sure to stay warm and stay healthy.
Thank you, Lauren. We appreciate that. All right, next item on the agenda is TSBA OPEB Trust Fund with Mr. Long.
We had our meeting this is gonna be quick too. We had our meeting.
Can you explain what that is for the audience?
Okay, we had our meeting last week. You had to do it virtual, which is a lot more aggravating than normal, but an OPEB is other post-employment benefits. This is a trust fund that was set up to help with retirees, with dental, vision, other insurance that we didn't provide if they needed it. The comptroller's office suggested several years ago that we do this, and we followed suit. I think you were in on that, and it's worked out real well. We joined the trust, the TSBA trust, in 2008, 2009. We were one of 3, Shelby County and Hickman County. We started that trust then. I guess it don't say what our contribution was that year, but I'm assuming we sort of followed suit with $50,000 is what we normally do. And we have contributed $50,000 to $25,000 a couple times. A couple times we haven't contributed, but I think the best we can find out in total, we've contributed about $700,000. The fund right now is started out at the beginning of the year $1,088,410, and then we ended the year this year with $1,487,000. So we made money this year, as rough as the year was, but it's carrying on. They're doing a good job with the trust, and we're, if we need it, we got money in there for our teachers.
Definitely a great thing to have.
And this is for their benefits,
For
so
their
that
benefits.
we don't run out, or they don't have to worry about their retirement or any of their benefits.
Yep.
All right. Any questions of Mr. Long?
If I can't answer them, I'll get the answers. If I can't answer them tonight, I'll get you the answers.
All right. Next item on our agenda, this was tabled last time for Mr. Matheson to be present, maintenance vehicle discussion. And we're going to turn this over to Mr. Matheson and Dr. Long and Herbie Adams. Mr. Matheson?
Okay, sometime back we discussed this. We didn't really get into no details, but I've been approached again by a couple of individuals in my district about why all the maintenance vehicles from the school bus garage has to be driven home every night. And when I was campaigning, one of the individuals asked me then about it and wanted to know why it was that way. I said, well, I don't know. I said, it's a school department. But again, he approached me here a few weeks ago. This one individual did, and he said, I thought you said you was gonna do something about that. And I said, well, I've tried, but I said, we've not really got into depth on it yet. But he said, I don't see where there's any reason that they need to drive every maintenance vehicle home. He said, that's costing the taxpayers money. And he said, why can't you maybe limit it down to, one person driving one home? I said, we elect the superintendent of schools. I said, that falls under them after they're elected. And so what I'd like to know is if we can decrease the amount of vehicles that's being driven home and give the justification why you drive them home.
Okay. Dr. Long or Herbie?
Daytime and nighttime too. Now you talk about one or all or whatever. If something happens, like last Thursday night, prime example, had a 3-inch water leak at the middle school. They were all there till 7 o'clock.
Hey, Herbie, can you come up here so that you'll be, you're hard to hear.
With the
And,
mask on.
and it's hard to see too, for the audience.
I I was talking about, you know, at the middle school last Thursday night, we had a 3-inch, can I bust this?
Right up here.
Had a 3-inch water line break, you know, and they were there till 7 o'clock fixing that, all of them were. There's just numerous things they do after hours. You know, we got custodians that work at night. Dustin generally goes around and checks on them at night. Then there's things that we do during the day that I wouldn't ask you, I wouldn't ask Mr. Mattson, I wouldn't ask anybody to get back in their own vehicle. There's a sewer pump at Rome Creek that we've changed out twice that normally would have Norwell do or something. So just the nature of the job, you know, I don't think it's fair to ask them not to.
A couple weeks ago, you had something at Laurel.
The water main broke at Laurel, and Smiley was out there. They were up at 4 o'clock in the morning, you know, him and Dustin, having to deal with that. So, you know, they're on call 24 hours a day, which the board policy allows for them to have the vehicle. You know, that's been in place since 1996. So, you know.
What about the wintertime with the roads and the things like that? What did you have last winter that?
What did we have?
You use last winter as an example. What did you have, or they can share with us too, what did you have that required people to go out after hours?
I couldn't name them individually. I have asked them to go back in their minds and say, they say on average somewhere between 8 and 10 times a month that they'll go out after hours.
Okay.
Like the heat shuts off, water freezes.
Yeah, they'll go check on it until, you know, our heat and air person, he's down the ways, so they'll go out and see what it is, diagnose before we get him all the way up here and that kind of thing.
Clean the parking lots.
Yeah, like Thursday night, you know, they stayed and worked till it's done, because if not, we was gonna have to cancel school at the middle school. Then they got out of that hole muddy as they could be and went home.
Right.
One thing that I would add is it would be hard, you want me to do this?
Yeah.
One thing that I would add is it's hard to imagine not having them on call. And the way the policy reads as written, it reads to me as if it says that they're on call because they have the vehicle. The converse of that being if they didn't, then they may not be on call.
If you had a call at night, let's say that you had a water main break, and you had a call at night and somebody lived away from here, what would they, if they didn't have a vehicle and their tools, what would they have to do?
Well, it's gonna delay the process getting it fixed by at least 30 minutes.
Yeah.
You know, and that could, 30 minutes difference last Thursday could have been a big difference.
Yeah, 30 minutes.
Granted, it was during the day, but if something like that happened,
Yeah.
you know, 30 minutes is huge.
Right.
Another thing too that happens fairly regularly is we'll have them, you know, they may make it back around to the garage at lunch, or they may eat lunch somewhere near the site where they're working for the day. But then they will take their, well, it's with them in their truck. They'll go back out to wherever they're working. Let's say, for instance, Dustin Crumley may be working at Doe. Dustin lives on the Carter County side of Butler.
Hang on just a minute. Keep that thought. We've got Dr. Kirksey online, so we're going to let him do his presentation. Don't lose your thought. Dr. Kirksey, can you hear us? Stephen, we can't hear him.
Yeah, I can hear you.
There you go.
Yeah.
Okay. I think what we have you for, if you can explain your title with the Department of Health for our audience, because this is streaming live, and then also what we've got you here, one of the things to talk about is the new quarantine rules that have been put in place by the Department of Health, because a lot of parents don't always understand why we're doing what we're doing, and they think it's a choice we have. So if you can introduce yourself and then explain the quarantine.
Okay, will do. Yeah, so I'm David Kursky. I'm the medical director for the Northeast Regional Health Office. So my region covers all the counties in Northeast Tennessee except for Sullivan County, so that includes Johnson. So in terms of quarantine, the Tennessee Department of Health has worked with the Tennessee Department of Education on recommendations for schools. So, but really for everyone, quarantine goes for everyone in the community that's been exposed to someone with coronavirus. So actually there's two different terms we use. So we talk about isolation. So anyone that's a confirmed case of coronavirus has to be in isolation for 10 days. So that's someone that tests positive, that's infected, they can spread it to other people. We think people can spread it for 10 days after their symptoms start, and actually for 2 days before their symptoms start. So when we do a case investigation, we look at any contacts within the 10 days after the person's symptoms start, or they have a positive test if they have no symptoms. And then we also go back 2 days before that positive test or the symptom onset and look for any contacts that that person had, and especially close contact. So our definition of close contact, which is important, is anyone that's had either physical contact with somebody, hugging, kissing, things like that, or in sports, if they wrestled, or they were within 6 feet of the person for 15 minutes or more. So that's our definition of close contact, and that includes 15 minutes. It could be, 5 minutes, 3 or 4 different times, or 15 minutes all in a row, like they were riding next to each other on the bus or sitting close together in a class for an hour. So the rationale for quarantine is after you're exposed to coronavirus, so after you're exposed to someone that has coronavirus and is shedding it, anytime in the next 14 days, you could become the next case of coronavirus. So those close contacts are the highest risk people for becoming the next case of coronavirus. And that can occur anytime in the next 14 days. So our recommendation is that those close contacts be in quarantine. So that means they don't go to school, they don't go to work, they don't go to other social events like church or visit friends or family, and anything outside the house. So they stay home for 14 days. Because we don't know when they're going to become a case or if they're going to become a case. And if we would just let them go in the community until they have symptoms, there's 2 problems with that. One is that we know that people can spread the virus for 2 days before they start showing symptoms. So they would be in school for 2 days, start having symptoms, and then, all those people that they were exposed to before they started having symptoms potentially could get coronavirus. The other thing is we know that, especially in school-age kids, up to about 50% of cases are asymptomatic, so they never develop symptoms, but they can still spread it. We think about 75% as well as someone that has symptoms. So to keep those people out of the public, those people that are most likely to become the next case out of the public, and so they don't spread coronavirus, we do quarantine close contacts for 14 days. So that would include anyone in the household that can't isolate away from the person, and then any close contacts, whether it's at work, at school, friends, family members outside of the household. The state health department says that they have to quarantine if they're identified as a close contact for 14 days. So there is a little bit of difference with household contacts. So with the household contacts, their exposure is ongoing. So if you're living with someone that has coronavirus, you continue to have exposure to that person potentially until their 10-day isolation period is over. So for household contacts, the quarantine period can be up to as much as 24 days, which we realize is a long period of time. Household contacts are the most likely people to become cases, though. So they're the people that we're most concerned about. So quarantine for a household contact. So say mom or dad has it, or a sibling has it, and one of the other siblings is in school. Their quarantine period could be longer than 14 days, depending on the isolation period for the case that's in the household. So, the time periods can get confusing, but again, the rationale is that isolation for the sick person for obvious reasons, that they're infectious and they can spread it, and then quarantine for the close contacts or household contacts, because they're the most likely people to become the next case, and that they'll be able to spread it before we realize they're a case. So those are the, since we don't have an effective vaccine currently yet, we're still waiting. Hopefully that'll come soon. Our best public health tool to reduce the transmission is isolation and quarantine of cases and contacts. So other measures that we recommend, I see everyone's wearing a mask, so we applaud that. I'm in my office by myself, so I'm not wearing my mask, but I have my mask with me. So other things we can do is wearing masks decreases transmission, hand hygiene, maintaining social distancing, all of those other things that we have to do. We're especially concerned right now because we're seeing so many cases in the community. There's been a spike recently, and I'm sure if you've seen the news or looked on the website, you've seen that we've had an increase in cases, and especially hospitalizations are way up. So we're at the point where, you know, the hospital is having to do things like cancel elective surgeries again. So we are very concerned about the level of spread in the community as well. And I think everyone, you know, whether it's kids in school, us in the community, us at work, need to do everything we can to decrease the transmission. We don't want the hospital system to be overwhelmed where people can't get appropriate care if they need it. And we also don't want spread. We're seeing lots of cases and unfortunately deaths in our nursing home population, you know, where workers in the nursing home are getting exposed in the community and then taking it into the nursing home. So, yeah, we just need to do whatever we can to prevent spread in the community, including in schools currently.
I think one of our questions has been the new quarantine guidelines as far as in the past, the school being able to tell a parent, here's when your 14 days are up, and now we're not necessarily going to know. I'll turn that over.
Yeah. Yeah, that guideline, I think, came out last week in regards to, you know, previously, and I know you've heard our calls on the Wednesday and the Friday calls. Our concerns with that is the fact, you know, currently, you know, we're able to sort of give the parent an idea of this is when your child can come back. And, you know, it may differ by what they're told from the health department by a day or two, but it does give us an idea, the teachers an idea, the staff, and the parents an idea. But by, you know, with the new rules, changing that to where the health department will notify when they can come back. You know, I do know of instances where we still have people that are back and have been back for 2 or 3 weeks. They still haven't received anything from the health department, but we knew they could come back because we were able to, you know, have those dates. And, you know, I think that's just a concern that we have. I know Wendy's addressed that on the call Wednesday, is the fact that, you know, I think it's going to hurt us in the long run because, you know, not only will the parents not know when the child can come back if they've not heard from the health department, but we won't have an idea either. So that is an issue that we're sort of worried about with the new guidelines. But I know that you've heard that on the calls.
Yeah, no, that's a great question, and I can address that. So, you know, so after we investigate a case, we do submit all the names of the cases and the contacts to central monitoring, which occurs in Nashville. So they will call the person every day as long as we have all the appropriate information. So we need their full name and their phone number, obviously, to call them on the telephone. And then we also need the date of their last exposure so that we can calculate what their quarantine period is, you know, when we're going to start the 14 days, or if it's a case, when we're going to start the 10 days. Unfortunately, with all of the dates, there's no hard and fast end date for several reasons. One is, for a case, their minimum isolation is 10 days, but they have to isolate until they're symptom-free for at least 24 hours. So if people continue to have symptoms longer than 10 days, their isolation period keeps going out. So for a case, there's not really any way you can say you're definitely going to be out of isolation on this date. We can tell them they're going to be a minimum of 10 days, which you can still do under the current way we're doing it. With the contacts, it's also the case that there's no, so people are in quarantine for 14 days after their last exposure, unless they become a case. So if at some time during that 14 days they start having symptoms and or they test positive, now they're in isolation for 10 days. So they can't come back to school whenever that occurs during that 14 days. Then you're going to tack on 10 days during which they're going to have to be in isolation. So that time can change. And then for household contacts, like we talked about, their start of their 14 days, we don't really know what that's gonna be until the person that's a case in the household finishes their 10 days. Plus, like I said, it's a minimum of 10 days. If they continue to have symptoms for 15 days, that gets extended longer. So one of the problems we were having under the old method where we were giving them the date is almost everybody's date changed, in the end. So almost all of the dates were wrong. And the other problem was that the schools, you guys were doing an excellent job of calculating dates based on, well, one thing is the school often knows about the case before we do, because people get their test result, and there's often a 24-hour lag before it's reported to the health department. Because people, hospitals and laboratories have 24 hours to report it. So there's often that 24-hour lag, and then it's usually the next day before the case gets investigated. So you usually know first, you calculate a date, then our case investigator talks to the person. They may get a slightly different story that, maybe symptoms started a day earlier or a day later, and then we get a different date than you all get. So then everyone has to change their dates. And then when they get monitored, like I described, there's all the different things that can change the date when someone's being monitored. So then the date gets changed the third time. So unfortunately, there's not really a perfect way to do it. The dates are always going to be a little bit flexible, depending on what either the case tells whatever investigator's talking to them at the moment, or based on if things change, like the person stays symptomatic longer or they go from being a contact to a case, those dates are always going to change. So the current situation that actually the state health department, we're working with them on the letters that people would get from the monitoring team, which they are currently proposing that they're not going to give a date either. But they're going to give them a letter that the patient can download, the contact or the case can download from a patient portal. That'll tell them the start date of their 10 days, but then it's contingent on them being well at the end of the 10 days, or their quarantine starts on such and such a date for 14 days unless they start having symptoms. So unfortunately, there's not a perfect way to do this, but we can always give them a kind of a minimum date. So we know that cases are always going to be quarantined from their symptom onset or their positive test date for at least 10 days. It may be more. And then contacts are always going to be excluded from school for at least 14 days after their last contact, unless they're household contacts. And then again, it can be longer. But then it's unless they become a case. So we can always give parents, and staff members, if it's a staff person, a ballpark or a minimum time period. But that end date, again, is always going to be a little bit flexible. There's really no certainty around when exactly they can come back. So we think it's kind of the most consistent and the best thing to do is leave it to the person that's calling them every day to determine when finally they can come back. And they will be able to get that letter from the central monitoring team saying that they are released from quarantine.
So how do we keep up with a student if we don't have a date or we don't have access to the date? How do we keep from losing students? I think we have about 50-something students in quarantine right now. So on those students, some of them may come back too early if we don't have a date, and some of them may get lost by not coming back, because we do have a number of students who haven't done anything on the virtual. They've just stopped doing anything with school. And I think our concern is how do we monitor the fact that they don't come back too soon and maybe pass something to someone else, or that they haven't come back and they've taken a week or 2 weeks extra, simply telling us that, oh, I'm supposed to be quarantined. We're just trying to look for some way where we could monitor to make sure we're safe and also that we don't lose students in that mix.
Right. Yeah, so good question. So the spreadsheet that you all submit to us actually will calculate that, 14-day period or the 24-day period for contacts that are household contacts. So you can always use that. You know that the child, in the first case, is a little bit easier to figure out. So you know they can't come back before 10 days if they're a case and before 14 days if they're a contact. And that's calculated automatically on the spreadsheet that our school contact, that Wendy submits to us and that we send to her with those dates. That's calculated automatically, so you'll know what the date is, the minimum date. They can't come back before this date, but it may be longer. So for the kids that are staying out longer, is a little bit more problematic, but I think that you could request that letter from the parents that they can get through that patient portal that says what their expected date they can come back. And I think that a trigger for asking for that letter would be is if they've exceeded that for cases, the 10 days, or for contacts, the 14 days. If they're still not back and it's after 14 days, could be a clue for the school administration to ask for that letter, or to question the parent about why the kid's not attending.
That sounds good.
Mm-hmm.
You have any other questions?
But I don't think, like the way we were doing it, we were giving a date, but the date was almost always wrong. So I don't know. We're hoping that this way will be more consistent, but for all of us, it's been a frustration before, and it's going to be going forward that there's not a firm date, but just because of the nature of isolation and quarantine, there's not ever going to be a firm date. But there are those minimum dates that we can work with. So again, that it's at least 10 days for isolation and at least 14 days for quarantine. But in both those cases, it could be longer.
I guess part of our frustration, and I know that you all are just as overwhelmed as the nurses in the school system, is, I know several people that have not received.
I know the nurses are getting hit pretty hard.
They are. We have several people that have been active cases that have received one phone call, and that's been it. Quarantine students, because they were contacts, have not even received a phone call, and, it's 4 weeks later and still have not received anything. I guess that's just my concern, because I know you all are so overwhelmed. Is that going to get to be a better process than what it's been in the past?
Yeah, so we are working with the central office to kind of improve that process. So, we have tried to recruit more people to help us with our case investigation. And obviously some people that you get are better than others. So, and I think they're having similar issues, with the monitoring teams in the state. So there is that process of continuous improvement to try to, make sure people are, you're getting good quality work out of everybody. So there's always going to be those instances. One issue with people not getting called is sometimes on the spreadsheet, we don't have complete information, or there's an error in the telephone number, and things like that. So that could be one reason some people don't get a call. But sometimes it is our fault, where, the central monitoring team, for whatever reason. Another problem is sometimes people are not answering calls. So currently the numbers that the calls are coming from a 615 area code. So some people just will not answer that call. They are trying to make sure that now, while they're trying to get a process where when they call someone from a 423 area code, that it's coming from a 423 number, but they're all coming from Nashville, the calls. So that's a process they have to work on.
Any board have any other questions? You have any questions?
No.
Wendy? Anything we've missed?
No, Dr. Kersey covered everything pretty well. I do think the biggest issue we're having right now, can you hear me okay?
Yeah.
Is that the delay in them getting contacted. I mean, their isolation or their quarantine time is almost over before. Sometimes we don't even know about it because the parents are supposed to call us, but they haven't. And
And we've ran into that multiple times, and then some of them are sneaking back in, and we've got it, had exposure, and it's hurting us pretty bad.
Dr. Kirks, let me ask you a question, you being a medical doctor. My understanding is that with coronavirus, even if you are not symptomatic, or even if you have a bad case and get over it, there are a lot of lingering health issues that occur after that after that case of coronavirus. If you get coronavirus, asymptomatic or not, that on down the line, there's cardiac issues, there's respiratory issues, and it can aggravate many other conditions that people have. Is that what you're finding? And also with the kids having different types of things that react afterwards?
Yeah, I would not say with everyone that occurs, but there are definitely people that, what they call them, the long haulers, that continue to have symptoms afterwards. So there are other infectious diseases that will do that, where you can have lingering effects after the virus is gone. So we don't think that they're continually infectious or infected. So the virus is gone, but their immune system is still kind of revved up and causing problems, is one of the theories. So there are people that do have continuing problems. Fortunately, that occurring in young kids, like school-age kids, is pretty rare. We do know we've had several cases of the multi-system inflammatory syndrome, which is the kind of complication that can happen in kids, also can happen in adults. We've had several cases in school-age kids in our region, but fortunately that's been pretty rare. Most people that are asymptomatic, there is some concern that there could be some lingering effects, but for the most part, I would say most people recover fully. But there are still some things, it's early on. We've only really known about this virus for less than a year. So there are some things we're still learning about it, but some people can have lingering symptoms and problems. But for the most part, I think most people will recover fully. One problem is that we're finding now that it appears that, there is a potential to become reinfected after about 3 months. Some people appear to some people appear to be becoming reinfected with coronavirus. So unfortunately, natural immunity, and it's unclear what proportion of cases will become reinfected, but we have seen some reinfections, and it's unclear how long that natural immunity lasts after you're infected.
And what impact would the flu season have on this same, going along with the coronavirus portion?
Yeah, so, it shouldn't have any impact on the actual coronavirus infection, but the problem is that, flu, every year we see lots of people hospitalized with flu. So I think 20,000 people died from influenza last year in the United States. So far, over 220,000 people have died from coronavirus. So coronavirus has been like 11 times worse so far. We're not even through with the coronavirus. But just having a large number of people hospitalized, and we know, during a bad flu season, the hospitals can be overwhelmed, have staffing issues. So if we're already having staffing issues related to coronavirus, and it's actually hospitalizations are increasing, and then we get hit with flu, it could have a kind of a devastating impact on hospitals. But we will also see, problems with, so for one thing, with our school nurses, it's going to be really hard to tell the flu from coronavirus in terms of symptoms. So the kids are going to have fever and cough and, kind of similar symptoms in most cases. The doctor is not going to be able to look at the kid or the nurse and tell whether it's flu or influenza. So there have to be some testing to try to sort that out. So that'll be the other issue, just lots of, there's going to be a lot of people excluded because of, fever and cough during the flu season, where they'll have to, be evaluated to determine whether it's flu or coronavirus. Fortunately, a lot of the things we're doing so we do recommend also that everyone gets their flu shot to help try to keep that down, both hospital admissions and all the, just the illnesses that'll be going around related to the two diseases. Currently we have a vaccine for the flu. We're waiting on the vaccine for coronavirus. But some of the other things we're doing to try to decrease coronavirus transmission, hopefully will decrease flu transmission. So wearing face masks, washing our hands frequently, social distancing, cleaning all those high-touch surfaces in the schools frequently. All of that stuff should help prevent having a bad flu year, along with getting flu vaccine.
We very much appreciate your time. I mean, this has been a very valuable consultation with somebody pretty high up that we normally wouldn't have gotten a chance to talk with. And of course, it streams and is also recorded so folks can watch it so they can get the benefit of your conversation. So we very much appreciate you and everything you're doing.
Well, thank you all, and we appreciate our school nurses have been excellent to work with, and all of our school officials and school boards, so we appreciate everything you all are doing. And we know everybody's under tremendous pressure, and this is something none of us have ever, experienced before, but I think everybody's doing their best job to, keep kids and the community safe.
Thank you.
Thank you, Dr. Kersey.
I apologize for being late to the meeting.
No problem, no problem. We appreciate your time.
All right, take care.
Thank you.
All right.
Thank you, Wendy.
Thank you.
Good discussion. So I think before we go on back to the school thing, Wendy, you have anything you want to add to this?
I just kind of want, sorry, I just want the parents out there, to know that that's been the hardest thing here these last couple of weeks, is they're not understanding that we're on they're totally overwhelmed at the health department. And we're having like a 5-day delay on some of those kids before we even know that we're supposed to quarantine them. If they don't call us first, potentially that they're symptomatic, we have no idea. Sometimes, like Dr. Kersey said, sometimes I get it to him first, sometimes I get it to us first. But we've had some pretty upset parents these last couple of weeks where we've had to call them back. Their kid has been in school 5 days of their quarantine, and they're like, why am I just now getting the call? We didn't know.
But I think the important thing for parents, and I know I've talked to a couple who feel like that the guidelines are within our control, and I've explained to them it's not really, and they think that it's that we have the ability to either do or not do what the health department's telling us, and I've explained to them that's not the case, that we have to follow what the health department's telling us. And it's for an overabundance of caution to make sure people don't get sick. But, I think that one of the messages that we need to relay to those parents also is that you all, as the school nurses and administrators, are doing your very best. But we've just heard Dr. Kersey saying that they're also overwhelmed, and trying to staff is a difficult thing, so there are some delays there. But I think he was very informative.
He was, and I just gave you all a little package from the conference call on Wednesday that we had with him, just to show that we are at our all-time high. We have spiked back up higher than we were in July. So we are...
Spiked at we as the county?
The whole Northeast region.
Okay, the region. You're not talking about the schools. Let's make that clear.
No, we've got,
Okay.
it's on there. I've got it. And the one for you all is broke down by county as well. But we are getting hit pretty hard in the county as far as the nursing home and stuff. We are. And we obviously have parents that work up there in the nursing home that's, we've got kids in the school system, and we're seeing a little bit of repercussions from that. Last week and into this week so far. But it is even higher than it was in July.
When you have contact traced, are you finding that this is being spread through the school, or are you finding that it's coming from outside the school?
It's about both, but we have saw several in the school here recently, and I think part of it is because of the calls that's not getting made, or them not answering the calls, like he said. I've had several people tell me, well, I didn't know if that was a scam or something of that Nashville number, but they're not getting their calls and some of them are sending their kids to school, and when they're supposed to be on a quarantine.
But my question is not so much the quarantine as it is the actual COVID cases. The actual COVID cases that you're showing are 7 students and 6 staff. So does that come, are you finding anything that shows that these people are contracting that as a result of being in school, or is a lot of that come, and I know you don't ever know for sure, but is that coming from outside contacts, like home contacts or work contacts?
It's this week and last week, it's probably been mostly school contacts.
Okay.
Because it seems like we've had a lot of asymptomatic individuals that have went and tested later, that wound up positive. We're going back 48 hours, quarantining those kids, and then within those 48 hours, those kids are becoming symptomatic, and the staff.
So how do you trace that to the school versus somebody got that in the community? Or
We
at home?
question them if they know they've been around a case at all outside of school, and most of the time they've been saying no, but we know that well, I can't tell them, but the individual that we quarantined them from was obviously a case.
Okay. So right now, there's 7 active student cases and there are 6 active staff.
And I know we need critical infrastructure, it's been very important, but it has hurt us. I will say it's backfired a little bit, recently on that, where we've, just like Dr. Kursky said, you want to exclude as much as possible, but where we do the critical infrastructure and we're allowed to let them come, even though they were exposed, until they become symptomatic, they technically were asymptomatic initially and have spread it.
Well,
And
so
that's
far,
pretty
it looks like you're doing pretty good because there's what, quarantine cases total of 63 as staff and students? That's the quarantine.
The dashboard, it's good, but I just don't feel like it represents the whole picture that we deal with at school every day. That was initially created, tell me if I'm wrong, Angie, was just so that we didn't have to send letters home to parents every day, that we were quarantining somebody every single hour, basically. That's what that dashboard was created for. So, I mean, it looks good, kind of like on the outside, that, yeah, we don't have that many, but we're dealing constantly, daily with just several issues. But that was why it was created, was so we didn't have to send letters.
Yeah. Well, you've got a lot of issues. Fortunately, we're able to keep our schools open at this point and not be flooded with this. And
I just have one last comment. We are circling back around to our 90-day initial infection that we had from back when we had our football team and our maintenance issue. We are at that 90-day mark. So we will have to start re-quarantining if they get exposed.
Yeah. Any of the board have any questions?
Question I've got, okay, but talking about this close contact, what are we gonna do in this basketball season? We're gonna be able to have the sport?
TSSAA has set those, I mean, they set that up as far as I know, that's.
What's your plans?
We'll deal with it just like we have football.
Yeah,
But I mean,
we
how do
had
you
a
get people in the gym? I think that's
Well,
the
there ain't
question.
gonna be many in
Right.
there.
There'll be 33%.
We had a preliminary conversation the other day, we're talking about a maximum of 33% capacity. And we had some early discussion about ticket sales and that sort of thing. And there was a rumor yesterday that went around that turned out to be unsubstantiated, that Bernard Childress, he's over the TSSAA, was going to say no winter sports. But as of right now, basketball's going forward, but it will be very limited capacity.
So masks and social distancing.
Yes.
And then folks who don't go to the ball game can watch. Are you gonna have that online streamed like you did football?
Yes. Yes. Chase has that set up for the gym, for the high school gym. It is not set up in the middle school because we only got two cameras. So.
But the question I have is that the players are gonna have a closer contact in basketball than they are in football. Because you're gonna be up in each other's face.
We'll deal with that when it happens. You know, if they're quarantined and there's games that have to be canceled, then that's what'll happen. But we'll still follow the same procedures and guidelines.
If they become symptomatic, we'll go back 48 hours and
See where they are.
See where-
When you have a ball game, do you check temperatures, ask questions?
I guess the players are.
Yeah,
Yeah, that's what
TSSAA
I-
requires
yeah, they have to be questionnaire.
they require athletes and fans to have temperature checks when they come in. That's TWSA.
And are you asking the COVID questions?
I think that the coaches, I'm not sure, Stephen, if the coaches still have that checklist. I think they do. They've been doing it. I know volleyball did when we had it, so I'm sure
You'll
basketball
have to
will.
answer the COVID questions and have a temperature screen and be wearing a mask.
Only thing I have for Wendy, I know Dr. Price, and I didn't want to bother him, he said cases are up, you said cases are up since July, but so is testing. So there's triple the number of testing going on, which you will have more cases because the tests are more. So the law of averages say that you're gonna have more cases when you have more testing. So,
I'm just
bring
kind
that
of
up.
seeing a lot more asymptomatic transmission is what
Right.
I'm seeing over the last couple of weeks.
When you're speaking of these cases increasing, is this in the population at the school or a countywide thing?
Well, it's a countywide thing. In that diagram, this is kind of what they go over in that call we have every Wednesday, just to kind of give a description of, it's called an epi curve, where it kind of spikes and it goes down and then it's high again.
What's the numbers coming out of the prison down there now?
I've not kept up with that. Recently, I've just had some concerns of the nursing home staff up there, that we've got kids in the school system from those parents, but not
They
that much
don't
in
break it
prison.
down on our calls as to where they come from.
Yeah, they don't. It's just a high all over the Northeast region. The one that Dr. Kursky's, Carter, Washington, Johnson, Unicoi, all those, we're just back in the 3,000s, I think, on that one epi curve it shows. And that's where it was in July.
Any other questions?
Yes, I
Anything
have
else?
one.
Yeah.
I want to make sure I understand this. Now, where you've been calling the parents and saying your child has been a contact and they're going to be under quarantine, you will not be doing that? You will let them know and then someone will be calling the parent? Is that the way it's working, or am I understanding it wrong?
It can go both ways. If the child is symptomatic and the parent knows that morning, they'll tell us that they're sick. So then we put them on our dashboard as exclusion until we know more information.
Okay.
Because on that new algorithm I gave you, if it says no exposure, it's one symptom, well, they can come back 24 hours.
Right.
Okay, if we exclude them because we know that they were a contact to a person in our school that was positive, we've been doing with the classroom thing, if it's a student, we've been doing front, back, side to side of the student, because that's about the 6 feet, 15 minutes in the classroom. Then we will notify the parent that they've got to come pick up their kid. And we've been told not to use the word quarantine. We've been told that we are excluding that student until further investigation is done by the health department.
Okay.
And like he said, we can give them an estimated date of return because we know when we put them out and when they were last exposed. But the final say-so comes from the health department.
Now, when their investigation when their investigation from the health department takes place, where do they go? The health department, they go to the kid's home and,
No, they can just call them. I put it on the spreadsheet for the Department of Health, or if sometimes when they get the test results back, if they get the health department, they call them because they come back with a positive test. So then they just give them a call. But like you said, not everybody's answering the calls because they're coming from Nashville.
okay.
And then the Path Group portal is sometimes delayed by 2 to 3 days. What else did you have, Ms. Reese?
You answered the question. I said, where does the call come from? And you just said from Nashville.
Yeah. And it may not come from Nashville. I mean, we have a local contact now, which Angie Stout is our
Okay.
local contact at our health department, but sometimes, so we've been instructed to go through her, and then she will contact regional health office with further questions that are difficult to answer, or if a parent has a question, then parents can also call her. I've had to send a couple to her.
Okay.
But it is just an ongoing thing we've just got to deal with, so.
Okay, any other questions? Wendy, thank you, and we appreciate you getting Dr. Kirksey on the phone for us.
That was Wendy's idea, and that was a great idea.
I think he was very informative, and we get it from the expert. Not that you're not an expert, you're becoming an expert. All right, Dr. Long and Nervy, let's continue our discussion on vehicles. Dr. Long, I believe you were in the middle of a conversation.
Like, the scenario that I was explaining was that often happens, and so I was using a hypothetical example that has happened. Say Dustin it's past his lunch break, and he knows that he's got several hours of work to do at Doe Elementary. He lives in Butler. He will finish his day at Doe and not report back to the garage. And that's time saved. That's more on the job time if there's that much work there to do. There's even instances where it may get past 4:30 and he's so close to being done, well, I'll just stay here till 5:15 till I'm done, and then I'll go home. Again, that's time saved. So those are the reasons that it seems like it's sort of in the back of our mind now after all the COVID discussion, which is well and proper. But with that Herbie laid out about the on-call and that sort of thing, and then examples like that. And in checking with the IRS guidelines, we feel like we're completely legitimate and legal. But
And does it cost a little bit? Probably does. But if we have something bad happen in one of our facilities, what's easier to replace a vehicle and some gas or our facilities? So that's what you're looking at. What means the most?
Do we have a policy?
We do.
Yeah.
Yeah,
And
it's
regarding
special
that-
use of school vehicles, and it's about board-owned vehicles. We've had it since 1996, and it says that they can, a list of board-owned vehicles to be assigned to a position requiring full-time use following the IRS requirements, and it makes them on call 24 hours a day, perform job responsibilities.
Who's going out in the wintertime to look at roads?
Darwin and myself.
Okay. All right. Well,
Regarding one other thing, I'm sorry.
well, I was just gonna say, one of the things, and I know Mr. Matheson's got some folks who've got some concerns, and I lived it when I was working at the prison and driving a state vehicle, because, people were out, they'd see the state vehicle and then somebody'd say something or other. So I know that anytime that happens, there's gonna be people who look at it and say, why are these people doing it? But I would say that these folks don't make the biggest salaries. And, I think one of the benefits that we have, and based on what you're talking about, and I know over time, there have been different instances where they've had to go out leaks of buildings, the alarm system's gone off, whatever.
Freezer shuts down. Yeah.
So, I see that the vehicles are, and do you have something that you have the staff sign so that they know the rules? In other words, if I'm at Doe, I'm not going to Food Lion to shop and then going back to Butler. But if I'm going from Doe and I pass through and I'm going to Laurel and I stop at the dollar store on the way home, and it's on the road that I'm going home, have we got something where we?
Well, what was that called? De minimis?
It's, when you read those IRS guidelines, it talks about de minimis benefits, but it doesn't explain them. So you can go to irs.gov and read there and search that term, and it's just a fancy word, as legal things are often written in with Latin terms. That's just a fancy word that means minimal. And it gives examples like that. Like if there is a store on your way home, there's nothing wrong with you pulling in, getting it, that sort of thing. But right, you wouldn't go from Doe to Food Line and back. That would be very inappropriate.
That's often the most criticism that I ever got. If I stopped somewhere on the way home and somebody saw that state car there, it was kind of like, why is he stopping at the store, with his work vehicle? And I'm sure that's what's going to happen to y'all. And I know it's been, in the past, we've had that same issue. People taking the vehicles home. But I'm concerned that, that we don't offer the greatest salary, but we're asking a lot of these folks, and many times it may be middle of the night or whatever.
These men, go ahead.
When you was warden at the prison, there was no maintenance man that took a vehicle home. They were on call.
But those maintenance men came and went from the prison. They didn't have to go to the schools and go back home. And our staff generally made more money than they're gonna make.
Well, not much more.
Yeah, they made pretty
Well,
good.
I'd say not much more.
I'd say they didn't
A
make
lot
a
of them was
very
eligible
good
for
much.
food stamps.
Yeah.
Is there any way, I know because there's some question of cost, is there any way that you could maybe come back next month and give us an estimate of what it might cost for one of them to drive their vehicle home, or drive that vehicle home for 5 days? If there's some kind of cost, that way we'll have something in our head. I didn't realize we already had a policy. And it's been redone.
2002?
The
Yes.
SBA's looked at it and it's all clear.
Mhm.
If we could get that and get we've looked at this several times over the years since I've been here, and I've never had a problem with it. Just like Howard said, if they're on their way home and they need to stop, get a loaf of bread, as long as they're not going home and coming back and getting a loaf of bread, that's a different story. But on their way home, I don't have a problem with it.
Well, and even if they're not doing that, the issue of having a vehicle because they are on call all the time.
Right.
Well, if we do that, another thing we need to look at too is money saved. You said something about what Norwell usually does something.
Yeah, you guys speak up. I'm kind of represent them. If you have any questions, they're here and they do the work. What's the cost on that pump, the sewage pump at Rome Creek, if Norwell comes and replaces it?
$6,000.
No, $6,000, and we
That's
replace
what-
it.
And what does it cost if we do it?
The cost of the pump, was it $2,000,
We keep
$2,500?
2 of those pumps at the shop.
Keep 2 of those pumps
Pull
there.
one out, we had it rebuilt, and it's about $400.
That's what I've been trying to tell this.
So right there,
They've done that twice.
Yeah.
so right there,
And that involves pumping, and not just money saved, that involves pumping a pit of human waste dry enough for a man to get down in it and replace that pump. So it's not just the money, we're talking about money right now, but it's not just the money, it's about their dedication and willingness to the job.
And do we expect them to get in their personal vehicle when they get back to the shop and drive home covered and such?
let's see, that's a savings of over $10,000 right there.
Yeah.
If you do it.
Some of the jobs that they do, it'll justify us what we're doing.
But you all can change the policy, obviously, I'm not telling you anything you don't know, but if you do, you would have to, because the way this reads, they're not on call without that.
If
I
they
don't know
don't
that
have,
I don't know that you would want them not on call.
if they don't have a vehicle with them, they're
That's
not
the
on
way,
call.
that's the way it reads. I'm no lawyer,
IRS.
I'm not trying to be, but just when you read it, it says, employees assigned full-time use of board-owned vehicles shall be on call 24 hours a day.
And if you look at having one rotating weekly to week to week, you've got Dave that does one thing, you got Tim Hodge that's our licensed electrician, you got all of our men do different things.
Yeah, I don't think.
So how
that
do you
is
know you're
efficient.
gonna have the right one on call? when
But
something
now
goes
this,
wrong?
when I worked at prison, we had the same thing. If it was HVA, they was on call.
Look at it.
But they
That's
went to
our
one,
policy.
they went to
No.
one place.
No,
Where did
they,
they go besides the prison?
they had a maintenance building on the compound.
But they didn't leave the compound.
Pardon?
We've got a lot of compounds. Yours was on
Yeah,
one
that's a
place.
big compound too.
Yeah, but it's not like going from Doe to Rome Creek.
Yeah, I don't think this equates to the prison.
I don't either, no.
But if we could get that cost, see, just to see, out of
We can
curiosity.
guesstimate, because we'll have, mileage
You go mileage, it'd take you a while to do it.
and
That's the reason.
cost of fuel at our cost.
Right.
I have a question or a comment. If you get Norwell to come up here for that hunt, when do they start charging you? When
They
they
don't-
leave down there, or do they do it for a set fee,
They
or what?
generally give us a price, because we have to pull POs before we can, get
Okay.
anybody to come out, so they'll generally give us a price and come out, they'll give us worst case scenario. And because we tell them we can't pay them more than we've got the PO set for.
Was their charge $6,000 aside from the pump, or was
No,
that?
it was everything, wasn't it, Dustin?
Yeah, well, if they do
Yeah.
it, which they've not, since I've been here, they've not changed one.
Do you have a contract with Norwell?
No, we price it out 2 or 3 different places to see who can get the best price. Usually Norwell, HVAC, who was the other one we've used? Was it Cook's Mechanical?
Yeah.
Ain't many people around that does it anyway, I mean.
No, and then getting on their waiting list.
Right.
I mean, there's nobody that's readily available.
It doesn't get work for us, we don't lose money on the job.
I think we'd be at a detriment if we didn't allow them to have the vehicles and get out and do stuff like they need to do.
We have a great group of men.
We do.
Well, I'm not saying that they're not a great group of men or they're being dishonest. I'm just saying that the taxpayers have contacted me about it.
But I guess what the taxpayers need is what's the cost of the building compared to what a car costs, and the repair issues. That's all I'm saying.
Well, they don't see, and I understand what Mr. Matheson's saying, because like I say, I've lived it.
Yeah.
But I think having, for us making the decision though, I think that it's beneficial for us to have them with vehicles to go out and do exactly what they're doing. because you would have had to call school off, middle school,
We would have.
if they hadn't responded so quick in the manner that they did. And like you say, you saved $4,000 on that call right there. I'm gonna say that would pay their gas for what little bit of gas they come and go from home, and if you've done it twice, that's $8,000. So,
I called Dr. Simcox at about 4 o'clock that day and said, it's too early to tell, but just go ahead and brace yourself. They won't have school at the middle school tomorrow.
He did. He was wrong.
is there any other questions that we have on this for right now?
If you
What
would,
is our,
just-
what is our procedure? What do we wanna do?
Well, get the cost, and let's look at it again in a month. If you have those figures in a month, I would think you would. And look at it again, and like I said, I just, that way we'll know, and it'll be broadcast on the airways that we know, so.
All right,
Thank you.
next item, first reading, the Johnson County Board of Education recommended change, policy 1.405, rules of order.
This is just a minor change on a suspension of rules. Our old policy states rules of order may be suspended by a 2/3 vote at any regular or special meeting. And it needs to say rules of order may be suspended by a majority vote of the membership. That was a training that I think Mr. Payne and Mr. Eason went to. So Mr. Payne called me about that. So that's just a simple little word change with rules of order and suspension of rules.
Okay, so that's the first reading. Budget update, Ms. Lipford.
Being that we're meeting so early in the month, I do not yet have revenue, but I have copies of all the expenditures in front of you. Just taking a quick look, the school department at the end of October was 28.56% of appropriations expended in the general purpose school fund. Expenditures for the month of October for general purpose were $1,487,526.78. The majority of these expenditures were salaries and benefits, and it also included the bonus payout for the non-certified employees. Taking a quick look at sales tax collections received in October, but those were for the month of September, $179,449. Collections were down $15,997, but if you remember, that prior month was very high in collections. It actually came in at $195,000. So taking a look at that, collections were down the $15,997, but they were up $31,405 from that same month in the prior year. Property tax collections weren't yet available for the month of October. And just remember that the numbers are before the split occurs.
All right, any questions of Tina? Dr. Simcox?
Yes, just a few things. Again, I would like to thank the maintenance crew for their hard work with the middle school. If it hadn't been for them, we would have not had school that day. But I do also want to say a special thank you to Sammy Eisenhower and his crew. He has helped us numerous times on many things with the football field, anything dealing with water, if we're having issues with water, and he actually sort of saved the day for us that day. So I did want to say a thank you to Sammy Eisenhower and his crew, who did a great job in helping us, and he's always willing to help us. I want to say a thank you to all our veterans. It is Veterans Day next Wednesday, and there will be no school for Veterans Day. So, we appreciate all of our veterans, what they have done for us. TSBA awards, remember those are Thursday, and they'll be virtual. So, I think that they're going to have something for Mr. Long on that day. So, please view in if you can. We did receive word today that we are starting to receive our Chromebooks, but these are from our first order in April. So it's a small amount. It's, I think, about 93, 98 Chromebooks, but it's from the ones we ordered in April that are starting to come in. 5-year plan update. Left that off the agenda. Just wanted to sort of let you all know we are working on the inventory plan. They've actually been trained on that, and we've purchased a program to help us track our technology inventory that'll be a lot more self-sufficient. So that is something we are working on. That is in your 5-year plan. So we had a WebEx on that this week. I do want to say good luck to the football team as they travel to Alcoa tomorrow for their first round of the playoffs. And I do want to say congratulations to our own Miss Tina Lipford. Got a phone call today. She is going to be on the TASBO board. And what that is the Tennessee Association of School Business Officials. you know, you all have TSBA, I have TOS, she has TASBO. So very honored that Tina is going to be on that board, so I wanted to shout out congratulations to her. And that's all I have.
Once again, Johnson County's putting ourselves on the map there.
We are.
People being represented in state boards. All right, so, let's see, is there any other, that's it on here. Okay, Mr. Matheson? We're just going around.
Oh.
We're in.
Dr. Simcox, did you talk with the chairman about this?
I did.
Okay.
I did.
There's some things in here that you and her need to maybe go over and look that was in this
Okay.
class.
Okay, thank you. All right, Mr. Payne?
Just want to wish all our veterans, you know, happy Veterans Day. You know, without our veterans, we wouldn't be what we are. Just want to thank you guys, and I want to say good luck to the football team. It's tomorrow night.
Tomorrow night at 7 o'clock.
Yeah, and it's what, an Alcoa?
Yes.
Yep. They'll be traveling tomorrow. Let's remember them. Now, will that be on radio anywhere?
I know it'll be on WMCT.
Okay.
Oh, and Jay said it'll be live streamed as well, so please.
Okay.
Oh, okay. Great.
That's all.
All right, Ms. Reese?
Well, I would like to commend the maintenance for all their hard work, and I know that y'all saved the day last week at the middle school, so thank you so much. I don't think you probably get the credit that you deserve, and I'd just like to thank everybody for what else they're doing. I know it's been a hard year, and I don't think it's going to get any easier for a while, so thank you.
Mr. Long?
I just want to have condolences sent out that we lost one of our personnel today, or yesterday, and just praying for the family and those around her. So.
I too want to express to Martine Hope's family our condolences. I know she was a big part of my kids' lives as they grew up, both in school and you know, she was whenever you went to a youth basketball game, she was there taking tickets at the door, and I know that she was a valuable person in our school system. I'm sure she was to her family. We also want to offer those condolences to her. I'd like to also thank all the staff, because you continue to go through all these hoops. I know Edna's had to deal with, you know, students who aren't doing the virtual training or are not passing. I know Wendy and her staff have had to deal with some irate parents who don't understand, and I understand the parent side of it too, but you've done an excellent job of keeping our schools. I know there's COVID out there, but you've done an excellent job in helping keep our schools as they are, along with the janitors and along with school bus garage, and the maintenance guys have done an excellent job, and everybody really has pulled together. And you know, I've noticed on the news where schools have opened and shut right back down, and you've done a fantastic job, and I don't think we can thank you enough, and really appreciate it. So, you have anything else?
No, I just want to echo, you know, with Miss Martine, she will be greatly missed. She had been with our school system since 1988, and she's definitely detrimental. She's worked Kids Corral, Kids Country, anything we've asked her to do, and she was a fixture at Youth League basketball. If you went to Rome Creek, you were going to see Miss Martine. So she will be greatly missed, and you know, they are in our thoughts and our prayers.
All right. Do I have a motion?
Move that we adjourn.
All right. We're adjourned.